welcome, a special welcome to every one of you, and of course, special one going out to my lecturers, my consultant. I see Prof. Yao said, and of course, I also saw Dr. Pinamana Powell, and everyone represented. Thank you very much. This is a weekly program I decided to be hosting to help reduce the level of misinformation when it comes to topical medical issues. And who better fits to do that for us than experts in the field, specialists, medical specialists. And today we have a special one at such. She is an expert, a specialist psychiatrist with a special interest in child and adolescent mental health issues. She is a member of Ghana College of Physicians. She is a member of West African College of Physicians. She holds an MSc in child and adolescent mental health from University of Ibadan, where she graduated as a distinction graduate. Please join me today, this afternoon, this morning, this evening, based on where you are reaching us from and when you are watching this recording, Dr. Peggy Ekrement, to share with us on the topic ADHD. Doc, over to you.
Thank you very much, Dr. Sado here. Good evening to all of us, and I'm honored to have all of you on the call, especially to my senior colleagues and my bosses who are also on this call. I'm very privileged to have you all join. So today we are going to be talking about attention deficit hyperactivity disorder. I'll quickly share my screen, then we can start. Okay. Okay, please can my screen be seen?
Yes, please. Very beautiful design.
Okay, let me just put it in slideshow. Okay, I'll have to put off my video to just ensure that the internet is stable. It has been going on and off for a while. So as I said, this in the next 20-30 minutes, I would attempt to summarize the condition we call attention deficit hyperactivity disorder. And as a mental health practitioner, I cannot start my presentation without letting us know what mental health is. Okay, so mental health is a component of health, and according to WHO, it's defined as a state of well-being in which one realizes his potential, one is able to cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her society. So children also enjoy mental health. And when we talk about child mental health, we're just looking at the psychological development of the child, the functioning, the child's sense of positive self, how the child is able to manage their emotions and build relationships, how they're able to learn and acquire and educate the society, which includes play as well. So we come back to the topic for discussion this evening, attention deficit hyperactivity disorder, or ADHD. So what at all is ADHD? It was one of the neurodevelopmental disorder. Is one of the common ones. Other neurodevelopmental disorders include intellectual disability, autism spectrum disorder, etc. And it often starts in childhood. And children with ADHD have trouble focusing, so they have problems paying attention and controlling their impulses. So sometimes they may act before they actually think about what they're doing. But I must say that we need to note that it's normal for children to sometimes have problems with their behavior. Maybe they are playing too much, or they are not able to keep their focus on one thing. However, when this is out of keeping with the developmental age, or it's so much that it is causing a distress to the child, it's affecting the child's education, causing distress to other people, then we may consider it a disorder. So ADHD is a triad of inattention, hyperactivity, and impulsivity. I'm going to tell us what these words mean, and I'm going to give some examples to make it easier for some of us to understand. So I put in a picture. It's a child who is supposed to be reading or maybe doing an assignment, but he ends up making a plane with paper and throws it around. Somebody is also the picture on the right. He's just looking elsewhere, not focusing at all. So we talk about symptoms of inattention. So children who have symptoms of inattention, sometimes they make careless mistakes. They do not give attention to much detail. So you realize that they make mistakes when they are copying from the board. They can copy the wrong thing, or they can even skip a line and write anyhow in their books. And when it comes to doing things that you need to keep your focus on, they're sometimes not able to do it. So they get easily bored. Their attention span is very short. Even when you're talking to them, sometimes as if they're not listening to you. By the time you realize they are daydreaming. So typical when a child in class and they are being taught, the child is just looking out of the window and looking at the bird that is flying instead of focusing on what the teacher is teaching. And when it comes to things that they have to focus, such as homework, they do not like it, or they try to avoid it as much as possible. It's not like they may not be able to do it, but it's just the ability to keep their attention on it that is the problem. And most often they may fail to follow through with instructions. So you give them an instruction that will go and wash the plates in the kitchen. By the time you realize some of the plates are still there, the tap is left running, but the child is sitting down watching cartoons. And sometimes too, when it comes to organizing their things, they can be a bit disorganized. Sometimes a child may go to school, he's supposed to have sent his PE kit, he would have left it. He goes to school with 2 shoes. By the time he comes back, he's actually holding just one. So they tend to lose a lot of their things. For the mothers who have children who are inattentive, you keep buying a lot of books, a lot of toys. Almost every day, the pencil gets missing. That's how you can tell if the child is inattentive. And I think I've spoken about this, that they can get distracted by external stimuli, like the bird I was talking about. And often when they are doing things, they may tend to forget. So this is a picture. We all know children who, when they come to their grandmother's house or when they come to your house, you've arranged your things neatly. By the time you realize they are rolling over the chair, they are climbing over the table and jumping onto the chair and doing races and all. We will term it in the medical term hyperactivity, but it's excessive activity. So the child is that's a lot of activity. So some of the symptoms that show that a child is hyperactive is that you find them, they often will just be fidgety. They can't sit in silence, so has to either tap something or move something. And often in class, they're the ones that you find that as classes are going on, they are somewhere else. Or because they can't sit still, they have to say, I want to go and urinate or something, or I want to go and buy a sharpener or something. We often realize that these children too may run about, like the picture we saw, be jumping on the beds, climb excessively. They can even climb trees to heights that may not be appropriate, instead of just playing under the tree. Often too, when they're playing, they may play very noisily, make a lot of noise, and some people may term them an energizer bunny. So they're always on the move, always on the move. They have a lot of energy and they do a lot of things as well. I hope this picture will explain some of the symptoms of impulsivity. So this is a child who is struggling to wait for whatever is in the oven to get ready. And some symptoms of impulsivity, the child we saw, they have difficulty waiting their turn. They can't wait in line. You're going to buy ice cream, they will skip the queue, or they would have left somewhere. They can't queue for anything. And often we realize that children who are impulsive, or even adults, some adults have ADHD too, so they may interrupt people's conversation. Two adults are talking, then by the time you realize the child is also in the conversation. And the child may also talk a lot. So there are some people that they say they can talk for Ghana, they can talk for Africa. Those are the sorts of children I'm describing. And another symptom of impulsivity is, blurting out answers before the question is completed. I'm not insinuating anything here, but I watched the National Science and Maths quiz. Sometimes the quiz mistress starts the question. By the first quiz, somebody's hand is up. I'm not saying they are impulsive, but that is how impulsivity is. The teacher is asking a question, you haven't even finished asking, but they are already giving the answer, which may be wrong. So there are three types of ADHD. We have a predominantly inattentive type, where the child is easily distracted, is not able to focus, forgets a lot. That we sometimes see more in females and girls than boys. And we have a predominantly hyperactive or impulsive type. So you have the activity, they're going all around and all. And sometimes you may have a combined type where you have all three symptoms together. So how common is ADHD? ADHD is quite common. It affects about 1 to 5% of school children. The prevalence in younger children is higher than in adolescents, and it affects males more than females. So it affects males 3 times more than it affects females. It's important to note that at different ages, the child may present differently, or they may have symptoms that are a bit different, but they all may have this condition. So the preschoolers may be the ones who are not listening. They don't see how dangerous things are. In primary school, they are forgetful, restless, disruptive. In adolescents, they're not able to plan well. In adulthood, they can be forgetful, impatient, etc. So talk about some characteristics that that can predispose a child to have ADHD. In some of the occurrences, we're not too sure what it is, but having some of these risk factors has been shown to having some of these factors have been strongly linked with ADHD. So it has a very strong genetic component. It can run in families. And if you're a male, you're more likely, the odds of getting ADHD is higher. Like we saw, it's more commoner in males. There are certain factors such as premature birth, low birth weight, etc., which also puts one at risk of getting this. And there's a growing evidence that in the mind, so there's a dysfunction of a certain part of the mind, the frontal portion of the mind, and sometimes some chemicals in the body, such as dopamine and noradrenaline. For those who are not science inclined, I won't bore you with that, but these are neurochemicals that usually for attention, for pleasure, etc. But these do not function optimally. And early abuse and neglect is also a factor. So this is the brain. When we look at the frontal to the left, the place where it's labeled prefrontal cortex, that's a part of our brain that causes us to, be able to plan, be able to control our impulses. But in a child with ADHD, this part of the brain does not function adequately. So how do we diagnose ADHD? The child has to be assessed. If you suspect that this child may have symptoms that may constitute ADHD, you would have to bring the child to hospital. There are developmental pediatricians who can see, there are child psychiatrists. Most psychiatrists in Ghana also see children with ADHD as well. So speak to your healthcare worker. A pediatrician, a psychiatrist will be able to assess. We need to take we need to interview the parents. Sometimes we give them some forms to fill to be able to rate the severity of the symptoms, and we need to examine them and also observe them. It's important to do all this to make sure that we are really dealing with ADHD. I say this because there are other conditions that may also be confused with ADHD. For example, there are some movement disorders. So the child may be moving in an unusual way. It may be taken to be ADHD. There are other conditions that can come with hyperactivity, like the child jumping and all. So you need to have a very good interview to be able to tell and know that this is ADHD, and also to pick up other conditions that the child may have. So I've just put these when you come to the hospital, these are some of the criteria that we use to diagnose, but it should have occurred, the symptoms should have been there for more than 6 months, and it should be pervasive across different situations. So we're not talking about the child who at home is very talkative, does everything, but when the child goes to school, won't talk or anything. Those are not the children we're talking about. We're talking about the children who behave the same way at home, at church, in school. And school is very important because that's where they do a lot of focusing. So we need to know that this also happens in school for us to be able to know that this is ADHD. I'll briefly talk about the treatment. I'm about wrapping up. So for us in the hospital, there are a lot of strategies that can be taught at home and at school, as well as parent training, etc. So we call certain therapies behavioral therapies, and it's very important to be able to help the child be able to focus and all. For some children, they may just need the behavioral therapy. There are other children too who we would have to give medicine to for them to remain calm or for their attention to improve. Some medicines that we give, we call them stimulants. They work on the chemicals in the body to keep the attention focused and all. I must say at this point that of late we've been having a lot of people. This is a prescription drug, but we've been having a lot of people come in, and even adults, they will say, oh, I have ADHD and everything. And we're realizing that because it's a stimulant, there's a possibility of people abusing it. So, if somebody comes to you saying, I think I have ADHD, I think the right thing to do is to tell the person to go and see a doctor for us to be able to ascertain whether this is really what it is. Occupational therapy is a form of therapy that helps the child also be able to have a routine, help with the focus and everything. We have trained occupational therapists in our hospitals who help the children who have ADHD. So we realize that there are some children who may outgrow, so to speak, these symptoms with treatment. There are others too, they will continue to have the symptoms into adulthood. And some people will also be okay and the symptoms will come back again. The persistence is not so clear, but these are what the findings have been telling us. And we realize that those who have more severe cases, sometimes, sorry, that's a typo, their IQ may be low or they may have other mental health conditions that make it difficult to control the hyperactivity. So what are some of the advices that you as a layperson or you as a health professional, I know there are nurses on the call, I know there are doctors, I know there are administrators, etc. there. So when you see a child who obviously is very hyperactive or very inattentive, you can tell the teacher that instead of Or we tell the teachers that they need to get the child away from the distraction. So if the child is sitting by the window, move the child from the window, bring the child in front. If you are giving the child an instruction, maybe you go to the cupboard and bring the books for RME, and you have to take it one at a time. You don't give them a very long instruction, they may forget. And when homework and things are being done, they have to be in breaks. Sometimes when you want to alert the child to do something, you can actually highlight it with a colorful pen or something for them to know that I'm supposed to do this, then the next time I do that. And as much as possible, children like to be praised for doing the right thing. So when they do something that is very good, you reward them. It could be in the form of a token, or even sometimes some children just giving them stars or something can make them very happy to keep that behavior going. What can parents and caregivers also do? I have to say that a lot of people may think that having a child with attention deficit hyperactivity disorder, especially those with the predominantly hyperactive and impulsive type, may be due to bad parenting. So they'll say, for those of us who understand, you know, but sometimes it is not. It is not the result of the bad parenting, even though we know that some parenting techniques may worsen the condition. So parents who are very permissive, you allow the child to do anything they want to do. They want to climb the tree, you let them climb. They want to jump from the bed to the sofa and everything. You let them. That's not the best way to help the child. And instead of allowing them to do what they want to do, sometimes it's good to, encourage them to put their energy into a useful thing. So if they want to play the piano, let them do that. If they want to use the energy to, go to the, like you, to go to the playground or something, go and supervise them. Some of the advice that we give to teachers we give to parents. Nowadays, there's a lot of apps that have come up that actually can help the child or the adolescent be able to plan their activities so as to keep their focus. Some of them are called organizers. You can just Google apps for ADHD. You find a lot of apps that actually help with planning. Some of them are similar to the ones that we also use to plan our days and our schedules and everything. So what are the consequences if ADHD is not treated? The truth of the matter is that if you do not treat ADHD, it may get worse and often may lead to school and occupational failure. Why is this so? Because the child, instead of sitting in the class, may be found outside playing, or may have joined a bad group of friends. And because of the impulsivity, they can do things without thinking about. So somebody can say that, oh, try this cigarette or try this marijuana. By the time you realize the child has been hooked on to drug abuse, the child is not able to complete school. They're not able to keep a job. For some children, they are rejected by their friends. There are some parents who even say, oh, don't play with this child. This child is too distracted. This child likes making noise too much. So you realize that they may be rejected, they may be bullied, and this may lead to them having a low self-esteem. And some may even go on to get depressed. When we talk about depression, it's a prolonged period of having a low mood or feeling sad, to the extent that you start not enjoying things that you previously used to enjoy. You realize that you don't have a lot of energy, the concentration and everything is down, to the point that some people can actually have thoughts of wanting to harm themselves or thoughts of wanting to end their lives. Accidents are a very serious consequence of untreated ADHD. So I know a child who lives on the first floor somewhere. He actually jumped from the balcony. And luckily for him, he fell on a car before he fell on the floor. And we hear a lot of things. A child climbs a tree, falls down, breaks the arm. All these, if we don't take care, they can have very serious accidents that can actually lead to death. when we talk about conduct disorder are behavioral problems where when ADHD is not treated, because they do what they want to do, they can become disobedient, very oppositional, they challenge authority and all, to the extent that some of these things can continue into life where now they are breaking very serious rules, they are lying, they are stealing, and they are being cruel to other people and all. Untreated ADHD also impacts the family very much, in that as a parent, when you take a child out somewhere, you realize that all people will be looking at you. You're not able to control the child just keeps going around. So sometimes some people even have to stay at home. They can't go for parties, they can't go for funerals, they can't take their children anywhere because of this problem. And it can actually lead to fights even between couples as to how to raise this child. So we realized that it's important to have a child with this condition treated. I end by giving us this take-home message that attention deficit hyperactivity disorder is common. And we have to know that it is not a result of bad parenting, even though, as I said, bad parenting can worsen it. And the good news is that there are evidence-based treatments which are available to help your child or to help a child you know get better. So what do we have to do? We have to speak to a health professional now. Thank you very much. I'll take comments, contributions. Thank you all for your attention.
Thank you very much, Dr. Peggy. We appreciate your in-depth presentation. Thank you very much. So it's time for questions and answers. If you have any questions, question, please put in a comment section in the chat box, and Dr. Peggy will handle all the questions for us. It's best to get correct answers from the expert. She's one of the best in the field. Please feel free to put your questions in the comment sections in the chat box, and she will gladly help you with it. Like I said earlier, it's a weekly program. After this is done, for those who join us late, the recording will be on my YouTube channel. So if you are willing, you can subscribe to the YouTube channel so that you get updated weekly, and as well get to benefit from the previous recordings. So if anybody has any questions, please put in the chat box. Dr. Peggy Ekremet will gladly answer your questions. She's done her very best to simplify to the understanding of every one of us. Please, if you have any questions. Yes, we had, of course, congratulations coming from one of our consultants, Dr. Pinaman Apau. Yes, she's appreciating Dr. Peggy Ekremet for wonderful presentations. Yeah. So anyone else have any question, any comments, please put in the chat box, and Dr. Peggy will gladly. If you're on YouTube as well, feel free to put it in the comment section. I will read it out, and Dr. Peggy will handle all of us. Okay, so from your presentation, it means this happens only in children. Now, this was a question I was going to ask. So, Dr. Ekremet, the question is going out to you that does this happen only in children?
Okay, thank you very much. So this, as I said, some children, when I was talking about the cause, so some children can outgrow it, but it occurs in adults too. So we have adults ADHD. I personally know people that I know they have ADHD because you can tell the person is able to combine so many things, do the things all at once, always running around. There are other people who also talk a lot, can take certain decisions, then you don't really understand. But in the context of the things that is happening, you know that it is not another mental health condition, but it is ADHD. There are some adults too whom I've seen. We have some people in their 20s, 30s, and predominantly sometimes they may have symptoms of inattention. So when they go to work, they are not able to focus well, they are forgetting things, they are making mistakes. So yes, adults also can have ADHD. Thank you.
All right, the next question is, can a year-old child be diagnosed of ADHD? Dr. Ekremet. Okay, I'm sure she's having some network issues. All All right, whilst we wait for Dr. Ekreme, please get your questions into the chat box in the comment section. When she gets back, she'll answer all the questions for us. Please put your questions in the chat box. I see all of them. I'll read all of them out to her. She'll answer all of them. All right, put
Hello,
your
can you hear me?
Yes, I can hear you now. There was a
Okay.
question which asked that can a 1-year-old child be diagnosed of ADHD?
So a 1-year-old child most likely would not have started, the child is now getting ready to walk. They may not be talking. So usually we're able to make the diagnosis in a little more older children. I think we've seen children as young as 2, but for 1, it will be difficult to diagnose because, you need to get a lot of things to be able to make that diagnosis.
All right, thank you. Someone is trying to find out that someone says they are in the rural areas and if they come across such cases, can you give them a number so they contact when they have such cases in the rural areas?
Okay, so I'll put a number in the chat box. It's a number for one of the PR lines for Accra Psychiatric Hospital where I work. So as much as possible, because some of the treatments and all are controlled medication, would want you to refer to us for us to be able to do the assessments and if we need to medicate. Because most of the time, some of the medication even we give to children 6 years going. The others that we can give for less than 6 years and all, and the behavioral therapy for younger. So we would prefer that you'd let them come and see us. Or if they are pediatricians in maybe the district hospital or something, you can let them also. As I said, developmental pediatricians also manage children with ADHD. So I'll put up a number.
All right. Okay, someone is okay. Felicia, obviously you joined us late. You're asking about the causes, the risk factors. Dr. Ekreme talked about that, so she might go over it at the tail end. But the recording will be available so that you get to enjoy the full session. She was quite elaborate about that. So Lawrence is saying he is glad to be part of this. He's referred some cases to APH, so you should look out for them. And he's also saying that can it be cured or it just have to be managed? That's what he's trying to ask.
Okay, so as I said, the cause of the illness, as we know, some children outgrow it. So some people by adulthood, after some time of treatment, the symptoms have gone away. Others will have the symptoms, they may come, go, but for others, it can be chronic. And we're not able to tell who or who would have this cause. I don't know if I'm making sense, because there are various endpoints for it. I'm trying to find words that can make sense to all of us, but it can be chronic. It can stop.
Okay, all right.
But it doesn't mean that all ADHD can be cured. I can't make that blanket statement and say that all ADHD can be cured. No, because we know that some continue into adulthood.
All right. So the best form is to get the specialist, the expert to see and advise appropriately. No one size fits all issue here. Everybody is dealt with accordingly, case by case. Is how it is dealt with. Now there's a question. Someone says she has a student who does better with attention when the TV is on or with music, but you are advising that we keep them from that distraction. She finds it a bit contradictory. What's your comment?
The question is, let me go.
The student does better with attention. The student is able to pay attention better when there is music or the TV is on. Dr. Ekromet.
Okay, the person is able to keep attention when the TV is on or when there's music.
Yes. Yes.
Okay.
But
So,
in your presentation, you said they keep them away from such distraction, and she finds that a bit contradictory. So, what would you have to say to that?
okay. So, in a child with ADHD, that we know the child has ADHD, you know that putting on the television or putting on some music or something can distract them. However, there are people who, when they are learning, myself, for instance, if I learn in a very quiet place, I may fall asleep. So I always need some background music, but I'm not concentrating on that music. So we need to be careful what exactly the television or the music is doing to that child. If it's taking their mind off, that is not the best for the child. But as I said, there are other people who they can't be in the quiet. They just want something stimulating to help them focus. Well, there are different types of learners. So it has to be individualized. This also can be put out as like I said, but if you know this child, and I forgot to mention, so to make a diagnosis of ADHD, there's a number of symptoms that you need out of the symptoms for us to say that you have this. So it doesn't mean that if you are forgetting things too much, you have ADHD. No. Forgetfulness as a symptom can be a symptom of various things, including other neurological conditions, dementia. It could be that the child has some cognitive problem. So that alone as a single symptom we cannot use that to say that this child has the inattentive type of ADHD. So when you come, we are able to assess, and depending on what the child has, we're able to make the diagnosis. I don't know if this helps.
All right. Thank you very much. So most people who are asking questions join us a bit late. So, but just for the benefit of everyone, somebody is asking, how do we identify someone or a child with ADHD? All these were elaborated from the beginning. But if you can just summarize for everyone else.
Okay. So as I said, for ADHD, it's a triad. So the constituents are hyperactivity, impulsivity, inattention. So I gave some examples of hyperactivity as a child who is always on the go. I said like an energizer bunny, keeps going, is unable to sit still, keeps fidgeting, plays very noisily, child who talks too much. For the impulsivity, the child is not able to wait their turn. When you're talking, then they come and put their mouth inside. Meanwhile, you're not talking to them. They may take certain decisions that they don't really consider before they do. Those are some symptoms of impulsivity. For the inattention, they're not able to focus on a task. They may forget things. They may lose items. So a child takes a pencil to school, doesn't bring it back. It's not like a one-off thing, but consistently having that child lose things. When you're talking to them, it's as if they're not listening to you or they can't hear you. They are easily distracted. All those are signs of inattention. But as I previously said, when we assess, we are able to quantify what the child has to be able to tell if this is it or it's something else.
All right. Thank you very much. And those who join us late, please, the recording will be
Thank you.
made
I hope I've
available
summarized
on the
it.
YouTube link for you to go back and get the full picture of what she presented earlier on. Now, Lawrence is again asking, can you get us some of the assessment tools for diagnosis, please? Lawrence is asking.
Okay.
All right.
So,
Any other questions? Please put in the chat box in the comment section. I will read it out, and Dr. Ekremet will gladly.
some of the assessment tools actually, maybe we'll link up later. Some of them are actually free online. Others too, you have to pay for them. So I can maybe send a list to Dr. Seto here, and we can let you have it. But some of them are for the teachers to fill, and others for the parents to also rate. So when they do, then you're able to tell the severity.
All right, so when Dr. Eckerman gets me the link of the free and easily accessible tools online, I will add it to the recording online in the description of the video online so that we all have access to it. All right. Somebody's asking, is there any home remedies to ADHD?
Okay, well, I'm assuming you're asking about home remedies in terms of sugar and all those things. There's a lot of, there are some people who say that, oh, this child likes sugary drinks too much. So that's the cause of the hyperactivity. Or when I give this child this food or something, I realize that he's calmer or something. I mean, there's been talk, even though the evidence is not too strong, that sometimes chocolates and certain foods may make your child hyperactive, including the sugars and things. So, I mean, the evidence is still evolving, not too strong, but if you feel that your child, when the child eats this, the child doesn't become hyperactive, that's okay. You can decide not to give that, but to recommend certain foods or supplements. Some people even recommend omega-3 to help, and other things to help with the boosting the chemicals in the brain. I mean, yeah, it's okay to do that, but to go out and say that don't eat this, don't eat that, the evidence is not strong. Other home remedies will include setting a routine for the child. So sometimes you realize that some of the children, they can play, they'll be just playing, they will not even sleep. I forgot to mention that. So as a parent, you have to make sure that you establish a sleep routine for the child. When you are given instructions, give them one by one. Because you know that some children, when you start saying, go and take this, they've already run. By the time they get there, they realize that they didn't even hear what you said. So for those children, you need to break down little by little. If they are doing homework, don't let them do, even for typically developing children, we don't lump all the homework on them. So you do a bit, you take a break, you come back, then you continue, you take a break. That would help the child be able to keep focus instead of just letting them do everything at once. So these are some of the home remedies that you can, and as I said, children like to be praised. So if they've done, you say that don't jump over the bed or don't do races on the sofa or whatever, and they are able to refrain from doing that. You can tell them, oh, well done. Maybe I'll buy ice cream for you. I'll do this for you, just to keep that good behavior going. So that's also another home remedy that you can use.
All right, thank you very much. Any more questions, please feel free. Special recognition going out again to our consultants, Prof. Yao Osei and Dr. Apao, Dr. Pinaman Apao, also who joined us. These are our lecturers, the senior members, the senior people, and they are also here with us. Thank you very much. We appreciate you. Any question, please put in a chat box in the comment section, and Dr. Ekrement will help us. She's also provided the Accra Psychiatric Hospital PR line, the telephone line, Accra Psychiatric Hospital PR. If you have any person with any condition at all, any mental health issue at all, you can call this line and they will guide you safely and easily. How you access the services of the specialists, the consultants there, you can just call the line 0599-379011. All right, thank you all very much. Any more questions? Let us ask a few more questions so that we can now allow Dr. Ekremet to have a rest. She's done very well. Any more questions? Put in the chat box in the comment section for clarity. Dr. Ackerman, just a question from myself. You spoke briefly about abuse of the stimulants by certain adults. Just
Yes.
for you to go over it a little for me, I've heard, I've seen, and some people have actually come directly to me to request for it. So just can you tell us more about that?
Okay. So as I said, the stimulants that we use for treating ADHD, you need a prescription for it. And even for the prescription, it has to be stamped. And of late, as you said, we've been getting people come, both males and females. I once had my nephew sent forward some messages to me from a lady saying that she's on, she has ADHD and she's on these medications. And she was on, according to her, she was on like 3 different stimulants. And we don't do that when we are treating. We use one. And amongst us as professionals, we know, and even on the market, people are selling their medication to other students. So people say that in the university, they say that the methylphenidate makes them sharp. I've heard people who have ADHD are even selling their medication to their friends. And because it gives you, please, can I be heard?
Yes, yes.
Okay, my internet just went off again. Okay, it's back. So, people are selling their medications to other people and they are abusing it. It increases certain chemicals in the body that gives a certain pleasant feeling for people who do not have ADHD. Because if you have ADHD and these chemicals are not working well, when we give you the medication, it begins to work well. But in a usual person with normal amounts, it gives you that sort of high, or they say it makes their mind clear and everything. So people are abusing methylphenidates.
Yeah, so Doc, what would you say will be the downside to make people not opt for it? What would be the downside of people who don't have ADHD, who would want to use them because of their claimed benefits? What would be the downside? What would you say to discourage them? Because it's a prescription-only drug, but people are abusing it. It's quite common in the West, and it's getting to us also.
Okay, so if you do not need such medication and you take it, it changes the way the brain works. So there are certain places on the brain that we call receptors. So, okay, let me just break it. So the brain begins to as a person, once you begin to like that feel of the high, it's similar with other substances. The brain changes in a way as to want more of that. So in the end, you may become addicted to it. And dealing with addiction is very difficult. So I advise that for those who are tempting people, do not start taking a stimulant. If you think you are studying and you have a problem and you're not concentrating and everything, see a professional. Let us know what it is. Let us know how we can help you. Otherwise, the downside is that people are getting addicted to these stimulants and are finding dubious means, including putting the symptoms of ADHD on themselves just to get this.
All right. Thank you very much, Dr. Ekremet. Is there any last minute questions any one of us want to ask for any clarifications? But before we go, I don't know, I normally do this, but this is a special day. If I'm going to make our consultants also co-hosts, so that if they have anything to share with us, we are privileged to have them. This is not planned. It's not planned, but if we have Professor, if you don't have Prof, I will say regularly on a call like this, and Dr. is quite a busy woman. If she's available, you take advantage. So, Dr. Pao and Prof, if you have anything you want to share with us, any contribution, please. We want to feel your presence. We are honored to have you join us. Prof. Yawase and Dr. Pinamana Pao, please. We are glad to have you. If you have anything, any contribution at all, any comments. Before I will allow Dr. Ekremet to give our final remarks, if our consultants, our bosses have anything to share with us, we will be glad. If there's nothing, we will just, and of course, if there are no more questions, I know this is impromptu, it's not planned, just seeing them on the call, give honor to whom honor is due is always the rule. So that's why I'm doing that. All right. Okay. Yeah, I think Dr. Appa has some few words.
Okay. Oh, I just want to say congratulations, Albert, for such a wonderful program, and to say congratulations to Dr. Ekremet for such a wonderful presentation. I think she's done justice to it. And so kudos to both of you. And thank you for the opportunity.
Thank you. Thank you very much. We appreciate you. Thank you. All right. I don't know if Professor is available. If not, I will just let Dr. Ekremet give us her final remarks as it comes to. We see adults as well. I have seen some adults with ADHD, and once they start medication, sometimes the diagnosis may have been missed from childhood. So as they grow with it over time, and when it is diagnosed and they start medications, they do very well. The symptoms improve, and the parents, the patient, they are so happy with you. So we've all been educated and enlightened. Let's all be on the lookout. There is nothing wrong if you have it, or somebody have it, or your child has it. All you need is seek expert help, and where the experts are available to help you. Across Psychiatric Hospital, Kolebu Teaching Hospital, Pantine, we have Ankafo. Any pediatrician can be of help, especially developmental pediatricians can be of help. It's a multidisciplinary approach when it comes to the management. So they're going to work together with experts like Dr. Peggy Ekremet and other psychiatrists to help give you the best result. Essence of this is to educate all of us generally so we know about these things and, of course, how best to handle it and where to get help. Dr. Ekremet promises to give us some materials which I'll compile and add to the description when I upload the video. So when I upload the video, you will see the document that she promised us. It will all be there. So if you're on the call and today is your first time, maybe this is the channel link. Feel free, take 2 seconds, just subscribe to the channel. So that when I upload a video, you can also benefit from the previous ones as well. Share with your friends so we all have accurate medical knowledge. Dr. Ekremet, please, your final words on ADHD and anything.
Okay. So my final words are that ADHD, mental health is enshrined in a lot of myths. So I'm hoping that we have really demystified ADHD today. It's not a curse. It's not as a result of bad parenting. It's not like Wakwaji Nsioba, as they will say. Some people will come and say, you want to collect. So they took away the child's brain. Who has any of these symptoms? Kindly speak to your health professional. We are always available. And as I said, there's treatment available for them to function well. Thank you very much.
Thank you very much. Please, together, join me say a big thank you to Dr. Ekremet. She did this with a very short notice. She availed herself to educate all of us. And like I said earlier, the recording will be available to all of us who joined us late to benefit from. And as well, you can share with anyone, any parents may have children that may probably have this. Just share with them. When they watch the video, they will know what to do. When they watch the video, they listen to Dr. Peggy Ekremet, they will know that they will need to seek help for themselves or their children. Thank you very much, every single one of you. Once again, I appreciate you. It's been a pleasing pleasure serving you all. Let's all enjoy our morning, afternoon, evening, based on where you are reaching us from or when you get to watch this recording. Thank you very much.